Hey everyone, Dr. Robin here with Sports Chiropractic, and we had a request to go over carpal tunnel syndrome, what it is, what we do to help it, and what maybe surgical interventions there are. And what is carpal tunnel syndrome? So, as you can see, we have a hand here, and we have these bones here called the carpals. And if we look kind of on this part of the hand right here, you can see the inside of the carpals form this kind of tunnel here. There's a roof where there's a ligament called the flexor retinaculum. And right in this space right here, you have 9 flexor tendons and 1 nerve called the median nerve. So that's a lot to fit into that little tunnel. So what happens is nerves don't like to be pressed on. What happens if we press on our spinal cord? We're in big trouble. So if the median nerve gets pressed on by those flexor tendons, then our hand can go numb, we can lose function, we can get weakness or pain, mostly going to be in the palmar side of these hands here, especially that middle finger. What you can do to test and see if you have carpal tunnel syndrome is what they call phalanx test. You can kind of put your hands like this, and for about 30 seconds, see if your hands start to go numb. That's a pretty accurate test. You can also press really hard over that carpal tunnel for about 30 seconds, and if it starts to go numb or tingle, that could be a good sign. The best test really is a nerve conduction test, but these are much more simple. So what happens if we find out someone has carpal tunnel syndrome in our office? What we do is a lot of therapies to try to open up and stretch this tunnel so there's more space for that nerve to go through. We also do laser therapy, which really helps to reduce the inflammation on that nerve. Surgically, what they do is either, medically they'll sometimes go into this tunnel and they'll inject cortisone or corticosteroids, which help reduce inflammation on that nerve, which is helpful for pain. Or they'll go in there and they'll actually cut the roof of that tunnel, the flexor retinaculum, and they'll release that so there's no tension on that median nerve. So a couple things right there you can do to test yourself, explain what carpal tunnel is, what we do. And one other thing, if you're testing and these things do not show you have carpal tunnel syndrome, one thing that it actually can be coming from is not from the carpal tunnel, but you can have problems right here. The median nerve goes right through what's the lacertus fibrosus and the pronator teres tendon or muscle. And sometimes what we'll find is people will have numbness in their hands and they'll not have any of these positive tests, but they'll have numbness in their hand coming from tightness in the pronator teres. So what we do here is we do a lot of muscle work on there to release that, and that sometimes can help. So basically wanted to go over that. That's one hidden trick that it can actually, people can have surgery on this, and a lot of times it's not coming from the carpal tunnel, it's coming from here. So at Sports Chiropractic, we can help you figure out, where it's coming from, how to fix it, and if we can't fix it, get you to a great surgeon that can help you. Dr. Rodman, have a great day.